Welcome back. Before we went to break, Dr. Jones, you were beginning to talk about obesity and a couple other issues that you see in your practice. I want to give you that opportunity to continue that conversation.
Yes, one of my biggest concerns is, of course, sexual health. And unfortunately, in our community, that tends to be so taboo. But oftentimes when I see teenagers in the office especially, they are being pressured by other parts of the community, their peers, on experimenting with sex. They have questions about sex. And unfortunately, when they don't have good information, they act on the bad information that they have. So I encourage parents certainly to talk to their children about these issues before they're exposed to their peers who might be giving them bad information. And of course, most doctors, family doctors and pediatricians talk about these issues in the office, sometimes when the parents are there, sometimes when the parents leave the room. But it's a very important issue because also the rate of STDs is increasing. And a lot of children know that they exist, but they could not name what they are. Everybody knows HIV, but they forget about the others. And of course, emotional health. And I see a lot of angry teenagers. They're angry over issues that seem irrelevant, but in their household or in their school, they're very big issues.
Give an example of what a teenager's angry about that might be, that we might see as irrelevant.
I've had children to be angry because their parents can't afford to get them the best sneakers, the best clothing, the best food, the best things that they compare to other people. And I try to get them to understand that your parents are doing the best that they can do, and this should not be an issue to be upset about. Simply get what you need, and then be happy about all the other issues. But I think that unfortunately they also mirror some of their parents' frustrations and some of the frustrations of the peers at school.
Well, we're also in an instant gratification society, and I think kids are really prone to that, and everything is so available, it's so quick, it's so Ericka, on the whole self-esteem side of it, I mean, you get the young people in a different kind of environment. Does that give you the opportunity to come at it in a different way?
It does, actually. One of the things that we try to address in addition to physical activity is the emotional health. I remember last summer we had an instance where several of the young ladies in our teen program were expressing anger, and we got to the root of it with just dialoguing with them. Most of them were in a foster home situation, and they were really feeling hurt, abandoned, and they were taking that out in some pretty dysfunctional ways, whether that was sexual activity, not doing well in school, just really manifesting negative attitudes and risk factors. And one of the things that we were able to do with them is to make sure that the staff person was having an ongoing dialogue with them, as well as with their caregivers, to say, this is what we're seeing, and this is how we'd like to address it. We also partner with a social worker who comes in, and they work particularly with young boys around anger, but they also work with families of many adolescents and, believe it or not, elementary school students on anger issues and many other things right there at our Y.
You know, it seems as though everything we talk about is very complicated, and it certainly shows us that it takes the partnerships and collaborations of a lot of people in order to impact people's lives. And I think we can't say that enough for people, that it's not one organization, it's not one agency, it's not one situation. As we're talking, everything gets very, very complicated, and it requires a whole network in order to change someone's life. So, Maria, if I come back to you and your school nurses, I'm sure that the problems in elementary school and junior high school and high school are very, very different. And that would also suggest that your success rate could be very different depending upon where we are. What does that look like?
Actually, we do something called school nursing case management, where each nurse, besides the everyday running after everything that goes on in a school, we ask them to look at between 10 and 30, somewhere around 20 students who are struggling in school. And we have, over the past 5 years, actually measured their level of success with these children with complex problems. And we found that 84% of those children have made some gains in one or more of the areas that we're looking at. Through the intervention, through the collaboration. That they've made a change either in attendance, in behavior, in their quality of life in school, in their grades, or in their health. So they make progress because we can target those areas, and we can look at them as a team and collaboratively help them to make changes that then make them better students. And that's really our hope for every child.
And when you refer children, do you have the opportunity to have a ready, available set of resources where you can pull in the community when you need to?
You know, that's another thing that has changed very nicely over the years. Resources have come together very nicely. There's always a slight shortage, but we find that with our partners in the community, we can find resources for almost every child, be that a malformation of the face, we can find someone to help fix that, or a social emotional problem, a broken heart, and we can help someone to see that child for mental health issues. But those two things, dental and mental health, are still the greatest needs in the community.
In the community. When I look at some of the articles that you read about young children in particular who can't learn in school because their teeth are hurting, that's a very difficult thing to internalize, because those are the kinds of things we take for granted. Do you have a network, Dr. Jones, where you can get services for the young people when you need them?
Absolutely. There are several services in town. There are resources, as she said, from emotional mental health to dentistry. There's programs for people who do not have insurance coverage or who do not have dental benefits so that they can get those services. And that seems to be the biggest barrier to health or to those services that I see. But absolutely, there are places that we can refer.